Welcome everyone to YWCA Central Carolina's 2021 Stand Against Racism Forum. This evening, we're going to invite our attendees to join us in exploring how addressing racism is a public health crisis, and in that exploration can advance the work of justice in our community and empower people of color. We especially want to focus on how racism impacts the overall health of children and young people. Structural racism plays a large role in determining the conditions in which people are born, grow, work, live, and learn. These factors affect people's access to quality housing, education, food, transportation, political power, and other social determinants of health. Understanding and addressing racism from a public health perspective is crucial to eliminating racial inequities and to improving opportunity and well-being across our community. Tonight, we especially want to thank our Stand Against Racism sponsors. Thank you to Corning, thank you to Google Fiber for your generous commitment and support in advancing YWCA's mission. I also want to encourage all of our viewers to ask questions and to introduce yourselves in the chat. Keep in mind that you'll need to be signed into YouTube to do so. We'll explore this topic for about 45 minutes with prepared questions and then open up to questions from our viewers. I'd like to introduce our esteemed panelists. Tonight, it includes Dr. Ophelia Garman-Brown, Chief Community Health and Wellness Officer at Novant Health, Calvin Fox, Licensed Therapist at Perry Counseling, and Dr. Raynard Washington, Deputy Health Director of Mecklenburg County. These wonderful panelists could conduct a panel on their own, so you are just fortunate to have all three of them in this powerhouse panel this evening. And I want you to know they have invited me to call them by their first names. So to start our conversation, I want each of them to share opening remarks on why we should be addressing racism as a public health crisis. And if I could start with you, Ophelia.
Ladies first, huh?
That's right. It's the YWCA. We're all about empowered women.
That's right. That's right. That's right. Well, thank you so much for this opportunity. And I appreciate you putting this forth, because one of the things I would say is we should have been talking about this in this light since the beginning of time, you know? And I say that really because when you look at African Americans, since we have been in this country, racism and health, or the lack thereof, has been a part of our plight. Unfortunately, even when you look at the research, many people talk about Tuskegee, but I'm talking about way back in slavery, where women were used by doctors, in particular GYN doctors, to experiment on and to determine how this or that would happen or occur. So we've been not talked about this for far too long. And because we've not talked about it for far too long, it has been racism, which is, as my colleagues know better than I, a social construct that I think was really just created when Blacks and whites in particular, you know, to be able to make that distinction of who's better. Or who was not European was not as good. So when we look at racism and how it has impacted us in every aspect of life, and how every aspect of life, your housing and your employment, all of those things affect your health, then we can see how this is clearly a public health crisis.
Thank you so much. Calvin, will you share your thoughts?
Sure. Idea in mind how I want to approach this, and I'm going to get to that in a moment, but I wanted to pivot or just spend one part of this introduction just to kind of speak to, I know we're going to talk about the insidious ways that racism impacts health, and we're going to talk about that cumulative toll and chronic conditions and so on. But I think this forum is so timely for so many reasons, and I just want to kind of pay some attention to the fact that we're going to talk about racism, how it kills and gradually does these things, but I want to say that it also kills in a straightforward way and fashion. Straightforward in terms of just recently we saw our country pretty much brought to its knees with the pandemic laying bare a lot of things, but also I just want to speak to this, George Floyd's, the recent incident in Minnesota. Racism literally kills, like in so many other ways. It's a health crisis. The spectrum is very wide. And so I just wanted to kind of like frame this kind of sobering, but I wanted to start out with the outset, almost just wanted to kind of mention that briefly, why it matters to frame it in the public health context. Sorry about that sort of diversion, but I'd like to say from my point of view, it matters because many people have been doing this work of sort of bringing attention to racial inequities, and there's a public health kind of a matter for decades, centuries even. And there are a lot of people well known and some lesser known, but doing the work just the same. And I'd like to just briefly mention that what we're doing now is sort of a through line, part of that kind of continuous process. And I'll speak to one notable person. Historically, W.E.B. Du Bois had done this work back in 1899, where he, you guys may be familiar with this sort of report he's done, the Philadelphia Negro, which kind of looked at racial disparities within the city of Philadelphia and showed how the mortality rate was starkly different. And then you can extrapolate that same work, which you can look at the time, Chicago and other cities, and you see the same sort of phenomenon sort of taking place. So that work started, that's over a century ago, but I want to fast forward to even 1985, where we get the Heckler report, which kind of, for the first time, the federal government puts health experts on the issue of racial inequities in this country. And it was mattering then, it was brought to the attention then, it was kind of coming to the fore. And then there's been subsequent, because of things like that, we've had much more research and studies in universities and communities around the country since 1985, part and partial to that. And then we bring it forward to 2021, and we see that now you can see that it's almost a refrain now, like people saying, you know, racism is a public health crisis. And I'll just skip it. I promise you guys, I'm going to close it out. I want to say that it's important to frame it this way, because the framing, if we have the language, then we get better results with it this way. It removes it from the sort of individual. It's not a moral failing or behavioral problem or some sort of kind of individualized thing. We look at it more holistically this way, and I think we get more. So it matters for a number of reasons, but that's why I think it's important.
Thank you, Calvin, and thank you for raising up the ultimate of public health crisis would be death, and racism does kill. I'll hand it over to Reynard. Thank you.
Sure. Yeah. So great to be here with you all this evening. And you know, I'll just, I guess, the introduction by just saying, you know, in public health, we are so committed to really addressing anything in our community and our society that basically either contributes to disability, disease, or death ultimately. You know, so I think any issue, whether it be a biological issue or a social construct that results in some kind of biological issue like racism, it becomes a problem. Anything that impacts a community of people or sub-communities of people and impacts their health in a way that either can cause them to live not a full life or have a poor quality of life or have a shorter life, really is a public health issue. So, and I think I am so, as a public health professional, so incredibly passionate about addressing racism as a public health issue, because for one, that means people talk about it. And for so long, I think racism has been this sort of this social idea, this moral issue that we don't talk enough about, right? And so I think putting it into the constructs of government and connecting it to livelihood and life really puts it at the forefront of what we have. It requires us to respond and to think about it. So I think that's one important aspect of it. The second thing about it, public health, is, our system and what we do a lot of is measurement. We look to understand and we look to study to figure out how a certain issue might impact the community's health. We try to measure that in some way. We try to prevent it in some way. That's sort of the foundation or the framework of how public health operates. And that's one thing we don't have in the space of racism. There's not enough measurement. There's not enough data. There's not enough when it's happening, where it's happening, how it's happening. And so I think putting the public health frame on it certainly creates an environment where it will be studied, it will be measured, and there'll be concerted effort to prevent it, and not just prevent it on the surface, but really sort of prevent it at its root.
Thank you, Reynard. Let's talk a little bit about a concept that I remember learning about, thinking this makes a lot of sense. It's the weathering hypothesis. And just the background on that for our viewers, if you're not familiar, is Dr. Arlene Geronimus, who's now a public health researcher and a professor at the University of Michigan's Population Studies Center, coined this term weathering. She was a student at Princeton University in the late 1970s, working part-time at a school for pregnant teenagers. And she quickly noticed that the teenagers were suffering from chronic health conditions that her peers, whiter, better off at Princeton, rarely seemed to be experiencing. And she began to wonder how many of the health problems that these young mothers in Trenton were experiencing were caused by the stresses of their environment. So later in her graduate studies, Geronimus came up with the term weathering. It's how the stress of just anticipating and managing racism on a constant basis manifests itself physically in Black and brown bodies and in their minds. I'd like to ask each of you to speak to this. In your professional experience, how have you seen weathering manifest in people of color that you serve or that you know? Ophelia, you're on mute. I'm sorry.
I will go first because I'm going to be the briefest of all. I thought it was interesting that when she coined that term weathering, because when you look at weathering in its natural sense and not looking at it healthcare wise, you think of it like the Grand Canyon, right? That was weathering. That was the elements of the environment making a difference. And so the way you see that mountain, the way you see all of those things are weathering. And so I thought that was interesting. And the same thing happens with people, the way that their environment may wear them out, their environment, whether it's the environment that they live in or the environment that they work in or the environment that they're placed in for whatever reason, wearing them out. So that weathering to me really made sense, even in its natural way of thinking about weathering. I thought about persons like the stresses of life and what it would do to them and their diseases because they had already weathered the storm of the system and their illness, such as sickle cell anemia patients. They're weathering in that, just because I have that diagnosis, you start talking about me as a drug dependent person. And I have weathered the storm, a person with sickle cell, of having had such a struggle. And I know what that pain feels like, right? And so I look at diseases, and I could stay here forever and talk about stress and what stress does to us and the physiology of stress. I used to do a Physiology 101 : stress and what it does, because when you look at how it changes you, this weathering, how the Grand Canyon was created, this weathering, how it changes you is pretty incredible. And I think that when you look at us as a people with hypertension, diabetes, heart disease, obesity, you look at weathering and the stresses that our bodies have had to overcome. So I could go on, but I'm going to stop there because I want to hear my colleagues.
Thank you.
It never fails. It's either kids or dogs.
He hadn't barked all day. He hadn't barked all day.
So I'll just jump in and I'll say, I fully echo Ophélia's comments around sort of this analogy that basically the experience that a person's had or community has can really weigh on their physical body. I think we all know that. I mean, this pandemic has been a good example of that, right? We're all tired from a lot of different reasons. And so your experience sort of just starts to take pieces from you a bit at a time. And so certainly the idea of weathering, I will mention, I think it's really layered in many ways. Racism is a layered idea. I mean, I think, we'll probably talk some tonight about this whole notion of structural racism and the acknowledgement that racism doesn't just exist on a people-to-people plane. It's also sort of a policy issue in terms of the environment in which people live and the space in which they live and what's created those spaces and how they look and those communities, how they look. But living in a community where you are, for example, surrounded by other individuals who are having challenges economically, and those same neighborhoods often have lower access to healthcare resources or things that make living a healthy life easy, like a healthy park or a playground or gyms or a grocery store. Those same neighborhoods have a bunch of corner stores and places that don't sell good stuff to eat. And so you have that physical environment that people are living in, and then you add on top of that sort of other elements of racism where they are having to deal with discrimination and bias from individuals. All that takes its toll on a person's body. And so for me, that's what weathering is. I mean, you have communities who are disproportionately exposed to all of these factors that weather them. Everybody has stuff that weathers them, right? Because we all live. But these communities have a disproportionate, and it's multifaceted, just stuff around them that's taking and making it more difficult for them to be the healthiest version of themselves, which means they have to not only tackle those things, as Ophélia said, they got to deal with them, but it's harder because they don't have it's not as easy to be as healthy. And so I think as we think about racism as a public health issue, I think really tackling those structures is one of the biggest things that we have to think about doing as we move forward.
Thank you. Calvin?
Yes, I think, and I'll chime in as a clinician, I'll say that I arrived at this kind of notion of weathering indirectly. And I say that at the outset, early on in my career, I had this idea that I was going to work not exclusively, but primarily with teens and children, and with little understanding of how I had a general understanding how the environment kind of shapes them, but I had no idea the extent to which the environment that a lot of the kids that I was seeing at the time in Oakland, California at the time, that the environment was really weighing them down. And so I say this because over the course of many visits and a lot of therapy sessions, I started to realize a lot of the symptoms that a lot of the children that I was working with, that they were presenting with, there was a sort of, it wasn't their own, it was sort of approximation of their environment, this sort of residue, this spillover from their parents. And so I started talking to parents more and getting out more with other people in the community, grandparents, caregivers. And when I say I started to understand this notion of weathering, the stress, the sort of the housing insecurity, the underemployment, unemployment, the other things going on with those parents were easily linked and attached to the kids. It was just manifest. You can see those structural things embodied in the children that I was seeing. And so it helped me to expand the lens much more holistically and sort of have a earlier understanding of we call it weathering, but like I said, just this concept of everything in their environment, especially the chronicity of some of these stressors that they were dealing with, their parents and mom. The kids were walking images of their mom sometimes, downtrodden, heads on desk at school, something that seemed like something it wasn't, a lot of times resistance or whatever, but they were literally they will weather themselves. And so I've said this before in different ways, but I started to also appreciate the fact that a lot of the kids and people that I've seen throughout the course of my career then, and even when I fast forward to some of the work I've done here in North Carolina with respect to the death penalty and some of those clients, the weathering begins in utero and even predates. There's just this kind of legacy, this connectivity that you can't divorce it. And so I've learned to make sure I acknowledge and reckon with that. But I've seen it in quite a few families, this kind of generational racial trauma, stress, and all those other things that are associated with that.
And you raise an interesting point, Calvin. Our Black and brown children who are experiencing trauma, who are manifesting difficult behaviors, can often be labeled with diagnoses that are far harsher than their white counterparts. That happens all the time. It's well documented.
Yeah, and Kirsten, I can add to that point. In that same setting, it's interesting you mentioned that. I'm not sure if we talked about this before or not, but I've told select people know this story too. But in that same instant, I also noticed that same sort of pattern of misdiagnosis. Kids who were presenting with, if you look at the symptom set, and this is where the kind of racial bias came in, even with ostensibly good people. And it's not calling out colleagues or anyone like that, but you saw, if you put a blinder on two sets of kids, same presentation of symptoms, yet one kid gets anxiety, the other one gets disruptive, oppositional, defiant. And I also noticed that pattern too. And that's also another way that sort of this structural racism informed what happens to those children, because also those same children, as you can imagine, and this, it informed how the schools treated them, how their parents saw them, and eventually how the world writ large gets to see that kid who didn't get the benefit, the empathy of seeing, like, what, that kid has lost, or they saw a lot of violence, or lost their mom, or they got put out of their house last night. They didn't get that same luxury. And so that was also something that was a part of that situation, to add to the weathering aspect of things as well.
And it's so, thank you for the segue for talking about children, because we were next going to talk about how that ongoing stress of living with racism can lead to actual biological changes, such as hormonal dysregulation or actual inflammation. And when you have children that are perceiving that they're living in a threatening world, they can start to exhibit behavioral characteristics like hypervigilance. And that, I think a lot of us experienced that during the pandemic, that sort of rolling adrenaline as we dealt with fear and anxiety or grief. It does something to you. So, as to your point earlier, the pandemic has helped us get a little bit of a glimpse into what it's like to live in a hypervigilant state. So when you consider racism as a public health crisis, how specifically do you see our children, our Black and brown children, affected?
Is that
for anyone?
We're gonna let you go first, though. We're gonna let you go first, though, Cal.
No, you sure? I don't want to take all the time now.
No.
Are you? Okay. I'll be brief with this, but I can say that, well, there's a general understanding that brain development starts early, right, in infancy and childhood, and sort of it lays the foundation for future development. Experiences teach the brain what to expect and how to respond, just in a general sense. And so the development of these functions is sequential, meaning that, prior events impact future development. And when experiences are traumatic, which is what we're talking about tonight, racial trauma kind of entered that language of kind of everyday chronic trauma, whether we talk on the micro level, macro level, if it's just in the ethos and the air you breathe. That that, let me get my thoughts again. So that's sort of that chronically stressful, it changes the pathways that are getting the most response. It starts to distort things. And I won't get technical about this, but that'll get all the attention. And we can talk about, those things we talk about. I think telomeres, they understand these things now. It's coming like public language, allostatic like loads and everything else that happens in the brain. But the development brain particularly is disrupted and thrown off course. There's a type of stunting that happens, and it's hard to kind of rewire the brain. The young brains there's a lot of plasticity, there's a lot of chance for change in young children, but also if they're not getting what they need along the way, those things start to calcify. They start to become more rigid and more difficult to change over time. And in children, particularly the chronic stress, and I'll just skip to the chronic stress that I've seen, observed, and you continue to see, it leads to actual changes in hormones, and that causes, I think, talk about inflammation in the body, a marker of chronic disease, but then also just the exposure. And I'll just say a few things that I see often, even in the not just children that I've seen who have turned into adults too, some of the adults that I see. Issues with attachment because of those earlier kind of experiences, like trouble with relationships, boundaries, empathy, social isolation. But then there's the physical health, which I know you guys speak to this more than I can, but there's like coordination problems, there are medical problems, there's oftentimes somatic complaints that I've heard over the years. There's headaches, the symptoms like the stomach aches. There's a lot of stuff going on, heart palpitations, having heart attacks. So there's a lot within that spectrum of anxiety and panic that happens along the way. Issues with emotional regulation. I've seen a lot of kids, it's hard to down regulate, to calm down, and otherwise seem like, well, that was out of proportion to the situation. But those kids who had never had that sort of benefit, they struggle with that particular thing. Then there are cognitive problems with focusing and processing new information, taking in new information. And I can go on down the line, guys, but there's a whole subset of symptoms that you see with kids who have been sort of exposed to chronic stress, the stress on the brain in that way.
Ophelia, Reynard, share your thoughts about how our children are affected specifically by racism in their health.
You can have it, Reynard.
Oh, yeah. So I was just going to say, I think, of course, all of those physical manifestations of the stress are real. And I think we see that and at the population level as well. I mean, we start to see differences in school performance and communities and neighborhoods who are experiencing sort of structural racism, communities that are experiencing lack of access to certain resources and supports. We start to see developmental delays early in certain demographics of kids, sort of map those things not just to their race, but also to where they live. And when you start to see those differences geographically, it starts to make you wonder sort of what's driving it, right? And then you start to look at those families and start to see some similarities in terms of the level of trauma that they're experiencing from different sources of trauma. It could either be from the community level and their family directly. And so all those things start to impact those children in a period where they should have the opportunity and space to grow free of these severe stressors. And then you add on top of that, being in this time right now where there's easy access to what's happening in the bigger world to those kids as well. So they see on TV, another Black person killed by a police officer, and that level of trauma sort of lays on to bear what they see every single day, right? And so then these kids are having this level of exposure to trauma, and you have other kids who don't see any of that, right? And they're given the space to be children, and they're developing sort of free of this really tense stress. And that's where we start to see, even in those kids, those differences that play out again in educational performance. It plays out in their general health and well-being. Certain kids are more prone to have obesity issues compared to others. And so all those things start really, really early in life when these kids otherwise should have an opportunity to live a healthy and productive childhood.
I agree wholeheartedly with my colleagues. And I will say that I wanted to share this quick story. One day I was at a school and elementary school, and I was there with the Belt Foundation when I was on their board, and the Belt Family Foundation. And there was this little black boy. Predominantly black children at this school, but he just couldn't be still. He just could not be still. Nothing that his teacher seemed to be able to do could make him be still. So I got behind him. I'm grandma, right? So I went behind him and I started touching his shoulders and just sort of rubbing on him a little bit. And he calmed down and he got attached to me during that visit. And everywhere I'd go around the building, they let him go with me. Well, what I found out was the day before, the young boy's older brother had gotten killed and he saw it. What? What? I can't even imagine how the child was doing anything, right? And like the hypervigilance, the all of what the two of you have mentioned, I saw with that young man. And one of the things that, as you talked about, Calvin, that when I was with the task force and when we were looking at how we could really make a difference, we realized that we had to make a difference before the children were born. To your point, Calvin, we partnered with an organization called Upstream because Upstream looked at the intentionality of pregnancy, gave women a chance to talk about their reproductive health, and then help them in terms of some of the resources to be able to do that. And so when I think about how, as has been said, that child in the uterus of that mom is hearing these things, is living these things, whatever she's living, the child is living. We talk a lot about our children listening to Beethoven and all those kinds of things, right? Einstein music, we all have it with our children and grandchildren. Well, this was not what was happening with those children. And so we see that with in utero. So we need to help our young ladies in ways that we can to even not bring children into the world until they're ready, to deal with going out and understanding themselves. I'm sure Calvin sees this in terms of maybe even having a child because of what it might do for you. Well, that's not a great reason to have a child. And oftentimes that child is going to be traumatized. But let me just say this. As a doctor, when I was in Chapel Hills Medical School, before any of you were born, we did not hear of type 2 diabetes in children. If you had diabetes at 12, it was because you had type 1 diabetes, which meant that there's something that happened to your pancreas. You could have been as skinny as a rail, but something happened to your pancreas, the organ that gives you insulin that helps to control your diabetes. Something happened, right? A virus, we often think. We blame the virus for everything. A virus, we often think. And when we think about this in terms of the type 2 diabetes now, our children, because they're suffering from obesity, which is again a part of this stress, the obesity, and has been said, the inflammatory and the hormonal changes and the disruption in our hormones are causing these children to have things like diabetes, obesity, depression. And it used to be said that if somebody said a Black person killed themselves, investigate, because we don't kill ourselves. Well, we're not seeing that now. We're seeing that even African Americans are killing themselves, right? And so when we think about the different things that has been said, that there is so much that is happening to our children that by the time they become adults, they've gone through 2 or 3 lifetimes of trauma and are having to try to figure their way through.
I want to raise
one thing, Chris.
Yes,
sure.
And it'll be short, and it's just to tell in, because everything, it all kind of ties in. And one thing I left off about a lot of children that I've seen too, and this, you can expand this out to a lot of adults as well, but self-concept, and I'm talking about the psychology of it back to just in that sort of clinical therapeutic realm, but the self-concepts of kids growing up with sort of that everyday racism, the everydayness of it. I see the internalized workings, internalized racism, and sometimes you see how it reveals itself through things like, and it's another way that racism kills, even indirectly, but they're internalizing the racism. So there's low self-esteem, there's shame about being Black, or guilt, and all these other things. And you see it manifestly turning into sometimes feeling like they devalue their own lives. Like, it doesn't matter. If the larger world and other people and things don't feel like I matter, there's no value to my life, that racism is still seeped in. And, you know, I just want to say that because that's also a lot of the work sometimes I have to do to undo that too, because that internalized racism is real, and it's a lot to kind of wrestle with, but it's there too, even in self-concept identity a lot of times that I've seen.
And I think that goes with the suicide.
It is. It plays a large role. And when you said that earlier, the suicide rates, I'm sure you guys know, like if you look at it from demographically right now, young African Americans, 12, 13-year-old data, but you don't see, still the research still needs to get behind and push it further, but it's been like that it's been trending in that direction for a while. And that's for different reasons too, but yes, suicide rate is quite high.
Well, I have appreciated that in the examples that we've used so far, a lot of them have tended to represent poor children of color. But I think that, you know, health data shows that poverty and socioeconomic differences don't explain all the racial inequities in healthcare outcomes. Children with more means who are children of color are also experiencing racism. So I'd love to hear your thoughts on that common misperception. I mean, people can dismiss racism because they can just attribute it to poverty. I'd love to hear your thoughts about how poor healthcare outcomes are more a factor of racism than class alone.
I think to say it slightly differently is that, you know, racism, you know, that poverty and social economic determinants don't account fully for the differences that we see in health outcomes across communities. And I think there have been a number of interesting analyses that have really sort of supported this idea that there are other aspects of inequity that are influencing people's health outcomes outside of income and access to resources. One of the most commonly cited studies is a study that was done among pregnant women to look at disparities in maternal outcomes, and noticing clearly that even educated women of color with college degrees and sustainable living wages still experience disparities in terms of their outcomes, their maternal health outcomes compared to their white counterparts. And I think, you know, everyone's sort of talked about this in a way, but there are implicit biases in a number of our how healthcare is delivered, both in terms of how people are, both in terms of the structure themselves, in terms of, do you have quality healthcare accessible to you? Do you have a doctor in your neighborhood that you can go to receive quality healthcare? And then there are biases in how patients interact with those providers. And sometimes patients are treated differently or heard differently or responded to differently based on the notion of their race because of, again, maybe not even malicious, but just implicit bias people have about Black people or Hispanic people or people of color in general, and or assumptions they have about that demographic based on the number of other people they've treated that fall in the demographic, assuming that they're all the same. So certainly there are elements of bias and racism that can have direct impacts, and class doesn't matter. I mean, I think the situations that we've heard even in the national news around individuals being killed because of the color of their skin. I mean, it doesn't matter what their income is. You don't see income when you see race, right? You know, and so the reality is that that certainly is one piece of the puzzle, but it's not the whole story.
And I would just add to that when you think about another study, a cardiology study, and the cardiology studies would allow you so clearly to see who was getting the heart cath and who wasn't getting the heart cath. And what they basically showed was that an African-American man, 50 years old, same risk factors as a white male, 50 years old, both of them senior vice presidents for somebody's company, making a ton of money, right? Both of them. But one of them gets a heart cath much, much sooner than the other. That's the white male that gets the heart cath much sooner. And they've shown that literally. And whenever a doctor is shown that, a doctor will say, well, that's not me. That's not because of what Reynalda said in terms of the implicit biases. They don't even see it. They don't know that that's what they're doing. And they don't mean to do it. I would say that many of them don't necessarily mean to do it, but it's a part of the implicit, the unconscious biases that people have about Black people. And even when you start talking about diseases and how, we're treated for those diseases, you can have all the money in the world, but you might get a third generation high blood pressure medicine. You might not, if you're Black, you might not get the best blood pressure medicine on the market because for whatever reason, they'll say, this is better for African Americans, right? And so when you really look at how we are actually treated because of the notions of what we will do, what we won't do, our Latino brothers and sisters often, they won't stop eating carbs. So we're not going to even try to deal with them in dietary kinds of things, right? So when we look at class and race, class, people who are Black, who are in the upper class America, still have a great potential to not be treated adequately and by people that are not even appreciating that they're not doing that. Because most of the cardiologists would say they would never do that because they don't understand that that's what they're doing.
Calvin, you're seeing mostly insured people. They may be poor. Many of them might not be.
Yeah.
Racism is affecting people of means too.
Yes, and I want to actually qualify that. I see, I see the wide spectrum, and that's just always been my intentionality to bring just so many people in, right? And so, but to this point specifically, this class and race kind of issue, I sort of consider it like just a pernicious, it's a myth that sort of kind of deflects from, the sort of nuanced conversation and understanding of how these things are interrelated. Because if you do that, you can scapegoat. You don't have to do the work of racism either. It's like a capitalist, like a fantasy, like, just make more money and things will take care of themselves, right? And we've seen time and time again that doesn't work. It's a false dichotomy, and I'll say racism does, for example, lead to, in many aspects, lower income. You can make that association, education, wealth. So you can logically arrive at this conclusion, but race and class are inextricably linked. So I take that sort of point, but income inequality is not the end all be all of the lived experience of people of color. That's one part of it. It's part and partial of it. And, I think Dr. Washington said this a moment ago about, this study and the research around maternal just death and health. And that's one measure and it's significant. And in fact, just as a sidebar, my wife happens to be an adoption and surrogacy attorney, and she's even talked to me about on different occasions, people being aware of that data, especially African-American women and couples. There's a hesitancy to even want to become pregnant to with their own body. Like they are scared, like this stuff has real life implications. Like it's really, she tells me about how she has to navigate that. So I just want to just speak to that and then bring it right back to this, but this sort of like that. So the race and class kind of thing. So just speaking to this again, a lot of people are doing this work. There are a lot of researchers at Ohio State, which you guys probably know this, but they're looking at the ways that even wealthier African Americans, other groups of minorities are making more money, but they're watching how the toll that something like tokenism takes on someone. So the more you move up the ladder, that still increases your experiences with sort of microaggressions and everything else too, in the corporate space and everything. You don't have the luxury of being in some kind of rarefied space that absolves you of that. There's still even more pressure on it. So when we talk about a person could still be a CEO at, ostensibly equal kind of footing, that one person is still taking on a great deal of everyday stress, just trying to keep up a certain appearance, a performance that they have to, this kind of performance thing. So it still wears on you, it weathers. The weather is still, it's still happening. So I can say more, but I'll stop that.
I want to add that when we were talking about the class, as we're talking about the class, it just came into my heart and mind about President Obama. He was sitting at the highest spot in the nation, and sitting at the highest spot in the nation, he was scrutinized like no other. And for the first time in history, as he's making an address, someone yells out from Congress, "Liar!" I mean, that has never, ever happened, right? So he's a person that's as high as you can get. And I would have thought that America could say he's half Black and he's half white, but no, he was Black, right? And because of his Blackness, because of racism in America and his Blackness, yes, there was Republican and Democrat, and I'm not going to let you do things because of that. But there was also things that our last president, 45, was able to do and say that if President Obama had done and said, he would not have been in office but a minute, because he would have been removed because of the unequal way that we're looked at. And so I just wanted to take that to the highest level because we saw that, clearly saw that when Barack Obama was president.
That no one is exempt.
No one is exempt.
Well, we have certainly been encouraging people to pose questions in the chat. My colleague Claire is monitoring that. We don't seem to have any questions from our viewers for our panel at this point, so we can talk a little bit about policy if that's all right with you. But please, viewers, if something comes to you that you'd like to ask one or all of our panelists, please put it in the chat and Claire will get it right to me. One of the things we did want to talk a little bit about is policy. There can be examples of public policies, whether they're local or state or federal, that either can redress harms or create harm. And so I just wanted to share a couple of those examples and get your reactions about some policies that you think are either really working well and need support or are working in opposition to healing public health as it relates to racism. So for example, one example of a good policy that I thought was so interesting that helps combat racism and structural inequality is called the Crown Act. And it stands for Creating a Respectful and Open World for Natural Hair, which, I might not have ever had to think about, but it was created in 2019 by Dove and the Crown Coalition to ensure there was protection against discrimination based on race-based hairstyles, and by extending a statutory protection around hair texture and protective styles. So if a woman or a man chose to wear braids, locks, twists, knots, whether to the workplace or to public school, they did not get sent home. They were not told that their hair was unprofessional. North Carolina is not, just for your information, is not one of the 8 states in our United States where the Crown Act is law, but it is law in Orange County and in Durham and in Greensboro, North Carolina. So that's an example of where you're not shaming a teenage girl who chooses to wear her hair naturally and not chemically straighten it to have it assimilate with white hair. And that's just one example of a positive public policy that, if you're interested, it's very simple to Google the Crown Act and learn more about it. That really speaks to an issue that, again, I don't have to even know about or deal with as a woman who identifies as white, but that my brothers and sisters who are Black and brown deal with, sometimes suffering silently. So I just wanted to open that up to you all to speak to the policy side of things, good and bad.
Yeah, I mean, I think it's, policy is incredible. Public policy is really important, particularly as we think about the structures that structural racism and sort of people having a fair chance to live a full and healthy life, meaning they have equal access to opportunity, equal access to high quality education, and the supports needed to achieve those things, as well as healthy eating and access to physical activity, although a safe community without violence, right? So policy can make a huge difference in terms of making those things a reality for communities that are disproportionately impacted by those in a negative way. I think just an example of policy that I think could help, move the needle, especially on public health issues, is Medicaid expansion, which is an opportunity for us to extend basic coverage to individuals who can't afford it. And if you think about, one of the biggest drivers of health disparities overall is people having access to care, and access meaning they can afford it, and it's close enough to them they can get to it. And so this whole notion that we're not allowing or not affording residents who make enough money to afford their own health insurance an opportunity to have coverage as they're trying to bridge their way out of whatever their circumstances are, is a good example of policy that could help close some of the gap on disparities and certainly address some of the structural inequities that many in our communities of color are facing, because remember, we're disproportionately uninsured as well. So to not allow a resource that could tip the balance in terms of that inequity, really does just further fuel the inequities that we see in the community. So I think, policy making is really important. And that's just one example. I just want to stress that, it's not all, it may not always seem racist in terms of the way it's done, but when you start passing policies that disproportionately advantage or disadvantage communities of color, that's when you start to talk about really racist or structural racism in a way that we don't always call out, but we have to be intentional about calling it out.
And we certainly support Medicare for our seniors. So that's a publicly subsidized opportunity for people of a certain age to have great health care, so that I think about our own personal situation. Most of my friends here know that my husband had a major spinal fusion a couple of years ago and was old enough to have Medicare. And we would have been devastated if we didn't have that coverage. Why would it be fair for someone who earns less income and could be eligible for Medicaid not to have the same opportunity to have a full and healthy life? Calvin, Ophelia, your thoughts on policy?
Oh, I'll speak to policy real quickly, but I want to say something about the Crown Act, right?
Okay.
And and this is a little bit off subject, but still about hair, right? Like in the how we politicize Black hair, and we know historically what that's meant and what that means now. It's an extension of the Black body, so it's anti-Blackness, that unruly hair. We need to tame, we need to do something about it, right? But racism actually in this instance affects all people. And when we talk about hair and women around the spectrum, and when I tell you, like, I have a diverse practice. I've always maintained a diverse practice, but hair shows up, the curly hair. There are a lot of women still work to make sure they straighten their hair. White, it doesn't matter the spectrum, Asian subgroup, I think there's a hair straightening that happens that also is part and parcel of that same ideology. But then also there's dyeing blonde, right? The closer toward the ideal of European whiteness, everybody's still affected by it, you know, and I mean, like, there's political, like, hair is political too, and it pulls towards that same thing. And I think, you know, just when I heard you say that, and it does, we know the toll that it takes on a lot of African-American women of African descent with certain hair types, but no, most women are not free of that either. And I do talk about that when it comes up to, and in so many ways, like, it's a heavy sort of thing. But the policy, I'll just say two policies. The Anti-Racism and Public Health Act, if you guys are aware of that, that was reintroduced by Congresswoman Ayanna Pressley. And
Calvin, could I interrupt you for 1 second?
Sure.
I'm so sorry.
Sure.
Dr. Washington is in high demand as our Deputy Health Director, and he has a 6:30. So we don't want you to jump off for your panel that's starting now. Because you were on the train with panels tonight without saying thank you.
Thank you all for having us. I look forward to future discussions about this.
Thank you so much. Have a great evening.
Bye. Thank you.
And we'll finish it out, Calvin and Ophelia.
Oh, sure. And I'll just finish that part. So there's a bill, and now you can see this, actually, the bill that was introduced. And also, I think Congresswoman Barbara Lee of California also was a part of this. The bill to declare structural racism a public health crisis. And we've already seen that the CDC, for example, just a few weeks ago, as part of this, declaring racism a public health crisis. So that's a positive sort of policy, a bill being passed through. And then also President Biden, if you guys know about the executive order that 13985, that also is in the same category of things about racial equity and outcomes. And he signed that back in January. So those are two examples, many, many more, but those are two examples.
Thank you. Ophelia?
And he took it. Calvin took it from me. Those are the ones I saw too. And so I won't be able to. I won't speak further on those. And I think we get ready to go into bad policies like redlining and those kinds of things. So I won't jump over there. Over there.
We are actually at over time. I hate to say.
Okay.
But we're leaving people with an assignment if they don't know about redlining.
Yes.
They need to look that up. That would be an example of a bad policy that has segregated neighborhoods and prevented families of color from building wealth and accumulating wealth over generations with the ability to hand down a home in which equity has built to their children. For most of us, the home is the greatest asset we'll have.
That's right.
And so if I'm not allowed to buy in your neighborhood because of how my race is identified, that has repercussions across whole communities.
That's right.
But I just cannot thank you all enough. And Dr. Raynard Washington in absentia, Calvin Fox and Dr. Ophelia Garman-Brown, thank you for being friends of our YWCA. Thank you for being people who embody our mission of eliminating racism and empowering women and promoting peace, justice, freedom, and dignity for all people. It is always a privilege and a pleasure to be in your company. And we are grateful to have you on our panel tonight.
Thank you.
So, thank you.
Thank you for having us. Thank you for having us. Thank you.
Great pleasure.
All righty. Bye-bye.